All right, guys. So right now we are live. People can see us. They'll start coming in, but I just need a few seconds because I want to share this out. So um, hold on one second. I want to share this, guys. So hold on. So
So yeah, as you start sharing it out there, Anthony, I'll just start filling them in a little bit on a couple things that we'll be discussing tonight. Chiefly among those things, of course, as it's been for the past couple of weeks, is our good old friend Corona. So anyway, but not just Corona, we're going to talk about some of the incidents that have been happening because of it, some of the things that we're probably starting to see on the horizon that we're going to be facing. And, hopefully maybe we're going to discuss some solutions that we can come up with to try and bring that heat down a little bit. Because as always, when you have unknown dangers, or in this case, more of an invisible danger, there's a lot of fear out there. There's fear amongst the staff. There's fear among the inmates. And that goes to make for a very tense situation. I think that's some of what we're starting to see out there with some of these institutions starting to have some pretty severe riots and other incidents popping off. How are we doing there, Anthony? Are we starting to?
almost done.
Almost done. So we're going to try and get this out to, as many of our viewers on as many forums as we can right now. And, hopefully you guys just come on in, start interacting, start letting us know what your questions are, what your ideas are, what your specific situation is. What have you been seeing at your institutions? Have you seen a marked rise in violence? Are there problems amongst staff and inmates? Is it more inmate on inmates? This is the time where you see these inmates. They're really going to make an effort to try and take advantage of this situation, because there's going to be a lot of inmates out there that are just going to follow and go along because of the fear mostly. So that's really what we have to start attacking. Is we have to start attacking things on the fear side, but we also have to be ready on the tactical side to be able to go in there and retake, these tiers, these housing units, these yards, if it comes to that.
It's an invisible threat, something that we never had before, and that's also a 2-liter bottle of soda you're drinking there, Russ. I just saw that.
It's all I can do to stay up right now. I can't begin to tell you, man, it's not Corona or anything else. It's just everything else going on around me right now. But,
all right. So basically what we got going on, we're going to do some updates, and also we're going to answer a question that is a very unique question. We'll get to it after the updates, but can the coronavirus actually unite the inmate population against staff? And we're going to show you guys a video I'm sure everybody's familiar with right now. It's coming out of Lansing, Kansas, Lansing Correctional Facility out of Kansas. And actually what's cool is we have Greg Piper on. He used to work there, so he's familiar with the layout. But since, we're getting ready to get started, before we do the updates, let's just introduce ourselves again. So Russ, you mind going first?
No problem, Anthony. My name is Russ Hamilton. I'm a 27-year career guy with California Department of Corrections and Rehabilitation. Started my career off way back in 1989 at San Quentin State Prison. Eventually I transferred and promoted, and then I retired, and I couldn't stand retirement, so I came back in, did a few more years for a small juvenile detention facility in Northern California. Now my chief concern is I do a page on Facebook called Keepers of Chaos. That's chaos with a K. We do lots of training content, history, and so forth for corrections personnel only. You must be vetted to get in. And then I also try and do as much content as I can for Anthony there on Tier Talk.
I appreciate that, Russ. I always appreciate you. Still taking some time for some people to come in, but either way, we're still going to do it because we still have to get this distributed. So, hey, Piper, you'd like to introduce yourself to my audience?
Sure. Thanks for having me back on, Anthony and Russ. My name is Greg Piper. I'm currently the Director of Training for Guardian RFID. We do inmate tracking and security and risk analysis, software, hardware, and just management solutions for correctional facilities, any size, from a little 2-bed facility in Dixon County, Nebraska, all the way up to multi-thousand facilities all over the country. I've been to about 230 50 plus jails in the last 3 or 4 years doing this as the director of training. Prior to that, I spent 3 years with the Hamilton County Sheriff's Department, Chattanooga, Tennessee, as a deputy sheriff assigned to the corrections division in the jail there. And prior to that, I spent almost 10 years with the Kansas Department of Corrections. I actually worked at the Ellsworth Correctional Facility, but because it's a fairly small state, I did get a chance to go to all the facilities, and I have been to Lansing many times in different capacities. So I am familiar with Lansing, but I don't want to give any preconceived notion that I worked there, but I've been there several times, both on the SORT team and in different capacities.
Well, it's still great to have you on because you're familiar with the layout of the facility. Plus, you're familiar with the Kansas Department of Corrections.
Absolutely. I've worked with them for many years. I know the Secretary of Corrections, the Deputy Secretary, many familiar names and faces in that group.
Okay, so what I first thought we could do is go over some of the fallen correctional officers that were taken from us because of COVID-19. So just bear with me. I'm just going to read off a little bit about each incident. So as COVID-19 continues to spread around the country, the first responders on the front line are increasingly vulnerable to contracting the virus. As was feared, the death toll now includes a growing number of correctional officers and personnel. So what follows is a compilation of the reports by state of U.S. correction personnel who have died of coronavirus-related complications. For cities with multiple diagnoses, the links are ordered chronologically, with the top being the most recent. Now, this is coming from Corrections 1. So we have a officer out of Louisiana. A Louisiana prison staff member dies from COVID-19. Baton Rouge, Louisiana. The Louisiana Department of Corrections confirmed Friday that a staff member at the Louisiana State Penitentiary has died from COVID-19. DOC officials said the staff member's name will not be released due to the HIPAA restrictions and security concerns. But this is the first reported death of a state prison staff member, according to the report from Louisiana. Currently, 37 employees from the state's prison have tested positive for COVID-19, including 12 employees at Angola. DOC officials also reported 46 positive cases among the inmate population. There has been no reported COVID-19 related death of inmates. We'll update you once more information becomes known. By the way, I did get a recent update on, looks like there was another death in Louisiana. Again, I believe this one is from Angola. DOC officials said the staff member's name. Okay, I apologize. That is the one. Okay, I just wanted to make sure I'm giving you guys the right information. So that is the one. That is the first confirmed death. So what they did was they updated the site. I wanted to make sure. So that was quick. This is how quick Corrections 1 is, guys. I just got that today, Friday, and they not only did they post it, they quickly already updated the site. So that was well done. Thank you, Corrections 1. I appreciate that. We also have a Michigan DOC officer dies of COVID-19. Michigan Department of Correctional officer diagnosed with the novel coronavirus has died, according to an email sent to staff Tuesday evening. The employee was a corrections transportation officer in Detroit. It was from the Department of Corrections Director, Heidi Washington. She said, "It's a difficult day for all of us, especially those who worked closely with him over the years. His dedication and commitment to the safety of our state's residents will not be forgotten and will leave a lasting impact on our department." We also have two from New Jersey, one coming out of Hudson County. His name is Bernard Waddell Sr. He was 56. He was a 28-year veteran of 28-year veteran correctional officer at the Hudson County Jail. He died after contracting the coronavirus, according to New Jersey State Policeman Benevolent Association, which represents about 33,000 members around the state. He's going to be sorely missed in my department, said Ron Edwards, director of the Hudson County Department of Corrections. He was more than just an officer. He was a gentleman. We also have an officer I worked with, a very good friend of mine. This is a sad day. I know this gentleman, or I knew this gentleman. He was someone that was just all about integrity, definitely defined the profession in such a noble way. The department's hit hard with this one. His name is Nelson Perdomo. He was 44 years old. He was admitted to hospital in March after experiencing high fever and weakness. And then he was later placed on a ventilator. And then we found out just the other day he lost his battle with the terrible virus. He did have a GoFundMe page, which raised almost $20,000. This gentleman was well loved. New York, you have Officer Quincy Simpson, an 18-year New York City DOC veteran, worked in the Security Operations Division at Rikers Island. He had 18 years in, which I just mentioned. Correctional Officer Quincy Simpson served our department with dignity and honor for nearly 20 years. He embodied the very best qualities of New York City's boldest and was extremely well liked by his fellow officers. And that was said by COBA President Elias Hussamuddin. And then you also had the investigator that passed. He was a 56-year-old investigator. We did a show. We said his name in the last show as well. I don't know if you remember that, Russ, but he was an investigator out of Rikers. He died. I know it was on a Sunday. I forget the exact date, but it was a few weeks back. He was also taken from us by the coronavirus. Then we have an officer in Ohio named John Dawson. He was 55, worked at the Marion Correctional Institution. 55-year-old Mansfield resident had underlying health issues. The governor said he tested positive for the virus on March 30th and at one point was placed on a ventilator, according to the Marion Star. But he was a correctional officer out of Marion Correctional Facility. And then we had another gentleman, I believe his name is Kenneth Moore. He's a DC native. He was a correctional officer at the Department of Youth and Rehabilitative Services. And I'm sure there may be some more, but right now these are what I got. And it's hitting our profession, guys. Hey, any thoughts about this, guys? Greg, you want to go first?
Well, it's really very, very sad. Obviously, it's going to hit all areas of our life. The media has, of course, been touching on musicians and actors and people in the know, if you will, in the A-list. People who are being affected by this. I know that, when Tom Hanks had it, everybody was just panicking because Tom Hanks and his wife had it. And, what are we going to do if Tom Hanks isn't with us? And I appreciate that. I can, but it's beginning to reach into all of our lives. The fingers are starting to reach in and grab every area of our life. There's not going to be a person in this country that is not going to be personally affected in one way or another, whether it be someone who is very, very ill or have lost a loved one. So this is 9/11 on steroids. And it's not going away anytime soon. So we need to buckle down and be prepared. It's unfortunate.
And Seekez, my boy Seekez out of Connecticut, he agrees. He goes, once again, we're forgotten. I see nurses and police, fire officers, firemen getting delivered food, etc., by the public, and the great men and women behind the wall go forgotten by the most. Very sad. And we also have a nice comment from Mr. Coldwater Canyon. We need to look after our correction officers and the inmates as well. And I agree. Of course, none of us would argue that. And Dana Simpkins, we all know her. She says hi to us. I don't know if Greg definitely should know her. You should know her. You should know her, Greg. She's
yes, I know Dana very well. She's a co-worker of mine, teammate of ours. She's a fellow warrior, and we're happy to have her on the team. And she's a very loyal supporter of those of us with the thin gray line.
Yeah, we're being watched. And Russ, she says hi. Dana says hi.
Oh, hey, Dana.
So what I thought we could do real quick is just go over some of the updates that happened from today. And then after that, I thought we can go ahead and answer that question, where do we think the coronavirus can actually unite the inmate population? And I am going to show a video to you guys when we get to that point. I want to show you what's happening in Lansing Correctional Facility in Kansas. There's a lot of videos out there. I took this one video that was about 6 minutes long, and I want to show you guys that video. But first, I want to go over just a few updates. Obviously, a lot more facilities or agencies are going to start releasing inmates that they believe are low risk. And we expected that. I just hope that we don't rush it and miss things. And I hope that there's a precaution. So if you're going to start releasing these inmates, because remember, at one point, we were the threat going in. Now, if these facilities have these numbers that are growing with people that are testing positive for COVID, now the threat starts to come out. So I'll start with Russ first. When we start releasing these inmates back to population, should we take some type of precautionary measures?
I think that what we really have to look at with that is on precautionary measures is they should be screened going out. They should be tested going out. They should have their temperature taken when they're going out. And they should, have to provide that necessary contact information so that if that test comes back, if it's not an instant test, if it's not something that we can get to right away, that we have a way to, be reaching out and contact those people that they might be possibly transmitting it to. I think that some of these departments have jumped the gun a little bit, and they've just been very reactionary in what they're doing, and they're trying to please the public, and they're trying to get ahead of it in their units and their yards and wherever their housing is. And I don't think that they're thinking through the consequences of it. We've already seen some things with regards to not stopping transports and not stopping intake, and not keeping prisoners separated or segregated that are on different yards. And so I think that there's just been some bad planning going on. It's time to get ahead of that and start having some good planning and thinking about what they're doing with regard to these releases. Because if they're going to do it, they should have a plan, and it should be solid.
Hey, Greg, do you think that if we're going to release these inmates, and again, especially if we're releasing these inmates from hotspots like Rikers and other facilities that are greatly affected, that as a precautionary measure, maybe we should even quarantine the inmates that are getting released until, we make sure they're clear of anything related to COVID?
Yeah, it's almost like we have a step down mechanism in place for these. Especially when you're talking about state facilities. I have talked to many, many county facilities over the last 2 or 3 weeks, because that is the majority of my client base. And they have dropped their populations, obviously, in county facilities, or as we talk about them, pre-sentence facilities. Their populations have dropped way down. They've cut everybody loose they possibly can. I talked to a jail of normally has 250, and they're usually full capacity. They're down to 87. So a lot of facilities, state facilities, though, would be different than the county facilities, because state facilities, these are sentenced individuals. So we're talking about having to change parole structures and commuting sentences and things like that. But in this particular case, yes, we need to get them out of the facilities, and there needs to be a step down mechanism, a way to, like you using trailers. Maybe we put them in I know they've been trying to find hotels. Maybe, you put them in for 2 weeks to confirm they're clear, and then kick them out the door with a new parole plan, a new probation plan, however you want to look at it.
Yeah, because my concern is that if they get released, they don't go directly to medical. They may go right back into the community or something, and God forbid they're affected. Now we're just taking the problem and just traveling it out. I think that we can kind of isolate things. And I'm not 100% with the big fan of immediate release, especially when I saw from the jail level first, because I was concerned that the jail was going to send people right back out to the streets without just thinking, or to the prisons who's already trying to scramble, dealing with what they got to deal with. So, but since it's happening, hopefully they're taking some precautionary measures as to, because I see it on a state level as well, as, okay, well, before we put these inmates directly onto the streets, they're going to have to quarantine here for at least 14 days. Because again, we're trying to isolate it. Also,
well, Tony, what you're saying though, Tony, is you're assuming that the facilities had a plan to put this in place. And a few nights ago, we just talked about how some facilities were telling their officers, as of early last week, don't wear masks. So right. A lot of our jails, a lot of our brothers and sisters and administration around the country have been caught with their you-know-what down. And they didn't really see this through. Some facilities did a great job, but a lot of them, they got caught not thinking, and they've been very reactionary. So our plan, you and I sitting here talking about, well, let's step it down. Let's quarantine them for 2 weeks before we get them in society. That's not what happened. So unfortunately, it's already happened, but we know that there's not going to be another big wave of releases. So if any future releases, I think they do need to be in quarantine. I agree with that. But obviously no one thought this through, because we had thousands and thousands of inmates released prior to this without any plan or forethought.
Right. And I actually hope that we're learning from each other. Like for the states that are going through it now, I'm hoping that the states that haven't had it happen are looking at the states that are having it happen and say, okay, these are things that work and these are the things that don't work. And me and Russ were talking about this the other day, and Russ, comment if you agree or disagree, but that this could bring about some type of consistency now, because as I said, I believe we're all connected anyway. And it's a shame how corrections just is never consistent with our practices on a national level. It's not like police. Like for corrections, a lot of our practices seem to be inconsistent, but for this here, there's so much we can learn, because the states that are going through it right now, if you're not sitting there and watching what they're doing and just making sure of what works and what doesn't work before it happens to you, then shame on you. And then what's going to wind up happening is when it hits at your facility, yes, your pants are going to be down, but you're also not going to have an excuse, right, Russ?
Oh, absolutely. And, it's really kind of disheartening in a way. One of the things that we used to talk about in all of the training and stuff that I did over the years is that, they're in the warden's area and stuff. They have a plan for everything. They've got a plan for war. They've got a plan for plague. They've got a plan for, all kinds of disruptions and things on the outside world that affect us on the inside world. And yet when it came time with this one, basically you heard crickets, and it was like everybody was waiting for someone else to make the first move. Now, there were some people that went out there and they took the reins and they got things going. But it seemed like for the most part, it was just, that engine just kept missing on cylinders, 1 through 6. So, I would hope that we would start thinking about these pre-planning scenarios that we've drawn up, and that we start figuring out a way that we're going to actually implement them if it comes to that. Because a plan that you can't implement is no plan at all.
Well said, Russ. Now, just to give some more updates, a women's prison in Gatesville is on complete lockdown after 11 inmates tested positive for COVID-19, and most inmates were placed on medical restriction for potential exposure to the disease. And this comes from the Texas Department of Criminal Justice. Dr. Lane Murray unit is among 4 Texas prisons placed on complete lockdown because of COVID-19 concerns. This was reported by the Houston Chronicle. The Murray unit is the only one in Central Texas on lockdown. At the same time, the largest union representing Texas Department of Criminal Justice employees is calling for the state to lock down all state correctional facilities, similar to how the Federal Bureau of Prisons implemented a 14-day lockdown on April 1st. The union believes placing all correctional facilities on a lockdown would be the best way to prevent the spread of COVID-19 within those facilities. And this comes from Jeff Ormsby. He's the executive director of the American Federation of State, County, and Municipal Employees, Texas Corrections. All right, so I'll go to Greg first, then I'll go to Russ. But I would like to see that. I think that I would like to think that all facilities right now should be on lockdown. You should not wait for it to be testing positive and say, okay, we have 1 or 2 positive cases, let's lock it down. I think at this point, we should be locked down. We touched on this yesterday, but just to kind of reiterate, in case people didn't see yesterday's show, if right now we should be acting on universal precaution, lock it down. I think a good lockdown for 14 days or maybe 21 days will give us back the control we need. Or if it hasn't happened in your facility, it could prevent the potential for it to happen. But hey, Greg, do you agree with the union representative there out of Texas saying that? Why are we waiting to lock down all the facilities? Why are we only locking down these, what was it, the few here that were affected? Why not do what the federal system did and just lock down all the facilities?
Well, absolutely. We can't wait on this. The whole point of social distancing and having people sequester at home or quarantine at home was not to quarantine all the sick people. It was to quarantine all of us so that we would get healthy. And so I think if you don't have it in your facility, by all means, lock your facility down. Because I think it was said so beautifully on the last time when I was on the show, the virus doesn't move, people do. And so if you stop the movement, you're going to stop the virus. We got to flatten that curve. We talked about one of our guests has mentioned the fact that, well, yeah, but courts have to keep going and this has to keep going. Well, guess what? In the county jails, yes, court has to be seen. But if you regulate that and get those guys in and out of court faster, then you're not going to have the backlog. And in a state facility, you don't have to. You can postpone the court dates. Yeah, put them off right now, or use video conferencing system. Have the mobile screens brought to the inmate location. But we have got to stop the movement of inmates within facilities, visitors, everything has got to stop for a minimum of 2 to 3 weeks so we can get this thing knocked down.
What's your thoughts on that, Russ? You agree?
Well, I agree. But the problem up to this point has really been there's not much sense in doing a complete shutdown like that if we're still moving inmates all over the state and we've got them in buses and we're just churning that population over. I've talked to people in numerous departments, state level departments, county, everything, where they're moving people around as if this virus is not even happening. If we're going to do this, we need to stop all movement, first of all, and then lock it down. so that we have a baseline to go by, so that we know that the inmates are either contaminated or not contaminated. And then as we progress through that, whether it's going to be 14 days or 21 days, as cases pop up, then we can do the tracing back and figure out where they got it from, and start looking at those, pockets that we've got left, figure out, who contaminated them, so that we can have a healthy, clean population and not have it run rampant through them. But if we're still doing all these transports and people are, going out to court and all this stuff, we'll never have a way to figure out where all of this contamination is coming from. And so, I have officers contacting me every day talking about how their department is still running buses across their state or across to the next county line and stuff. So somebody has to take the reins and say, whoa, hold on, if we're going to shut it down, let's do it right, so that we can have that baseline to go by and proceed with a clean slate from there.
Yeah, I agree. Both you guys, obviously, I agree 100%. If you're, when we talk about lockdown, we're talking about total lockdown, which means that you're going to have to shut down any access for the inmates to leave that area to go to the outside. Also, again, just to reiterate, if you happen to be that hot spot, then maybe because you're that hot spot, don't be sending inmates to other areas. Sometimes if your facility is that hot spot, don't be transferring inmates to another area, let's say far from where your facility is, or if you have a local hotspot within your facility, that's where you want to focus your resources. I just want to reiterate, because it's still happening. New York State, when New York City was releasing those inmates from Rikers Island, and some were going back to the streets, but some were getting sentenced to go to state corrections, they were sending these inmates from a hot spot like Rikers to upstate New York. And what happened was upstate New York wasn't really affected, and their resources were very limited. So I think at this point, it's best that if you have the concern, we can keep those resources within that defined area, and try not to spread. Just keep things locked down. And if you're a jail and you're looking to move inmates, if you want to get them released again, follow that quarantine measure like we mentioned, or whatever you got to do. But if you're looking to push the inmates to the prison side of things, realize that we're scrambling right now too, and that's not going to help us overall. And I'm sure we all agree with that. There's another unique story that came out of Albuquerque, New Mexico, where police were forced to release a suspect after jail refused to book him. Police say they were forced to release a man they just arrested on felony assault charges after the county jail refused to take him in on Monday. We demand that NBC cease unlawfully refusing to accept arrestees. Now, this comes from the Albuquerque police chief, Michael Gear. He wrote it to a letter to the Bernalillo County manager, Julie Morgus Baca. Witnesses report that the man, Joseph Vasquez, 38, had been yelling at them and ultimately pulled out a large knife and started swinging at them. Vasquez told police that he had been sick and coughing and thought he could have a fever. Because those symptoms are associated with COVID-19, the officers called an ambulance and Vasquez was taken to Lovelace Hospital. Greer said he was medically cleared to be booked and also tested for coronavirus. Days later, his test came back negative. MDC refused to accept and process Mr. Vasquez into the facility, saying that their COVID-19 areas was currently filled and we would not take Mr. Vasquez, according to a criminal complaint. Now, this is going to be a tough question. I'll go to Russ first. Do you think the jail did the right thing and not take the person in, or do you think the jail did the wrong thing on that point?
A guy that's going to be swinging a knife around like that, he's a present threat to the public safety. I don't know what they're thinking by turning that away. Part of the thing that we get paid to do is to take in risks and mitigate risks and, keep the peace. And so I personally, I think they did the wrong thing. I think that if you're just going to start, refusing people and, not making your facility that thing, which is the barrier between the public and chaos, then, what's the sense in having a jail at all? So, I'm definitely for locking up a guy like that.
What's your thoughts on that, Greg?
Well, we had policies in place at the correctional facility at the jail that if an offender came in, a detainee, however you want to look at it, POS, oh, sorry, didn't mean to say that. Somebody came in off the streets. If they had a medical condition that the facility felt like before we can take them into custody, before we can book them in, we need them to be checked out at a hospital by a medical staff. And that could be anything from, scratches, bruises, contusions, all the way up to broken leg, internal bleeding, things like that. They have to be checked out by medical professionals. So the facility has the right to refuse somebody until he's been cleared by medical. However, this is the kind of case where if they did say, no, he needs to be cleared by medical, he's going to get tested for COVID and he's going to get sequestered anyway. So facilities have to be prepared to have isolation cells for high-risk offenders. I'm not talking about a guy who got busted for speeding or a half ounce of weed or whatever it is. This guy, like Russ said, he was swinging a knife. This dirtbag needs to go to a cell, and we need to lock him in there until we figure out what he's got, because too many people are playing the COVID card. I'm going to cough on you until you got COVID, and they're going to try and get out of going to jail.
Yeah, and actually, I agree 100%. I was actually just going to touch on that before you went into it, but you're 100% correct. I believe that some people are going to take advantage of that, and they're going to say that they have symptoms or fake symptoms, and then the police may get a little weary, and then even the jail may do something like this. But to me, that's a hell of a precedence where now you have someone who may have COVID or may have the symptoms of COVID, and the jail is just saying, well, we're not going to take them in. I think that sets a wicked precedent. And Gibbon says the jail that he works at refuses to accept Class C and some B arrests, but any type of violent offender or felony, we still have to accept, even if they have the COVID or symptoms of, I guess, the COVID-19, or the coronavirus. So, Russ, obviously, Russ being in the system, being, San Quentin man, I'm sure you could see how some inmates would probably take advantage of this, correct?
Oh, yeah. The term inmate is just synonymous with opportunist. So whatever opportunity that they can see for faking symptoms or saying that they're going to cough on you or feigning illness to go look at the nurses up in medical or get to an outside hospital and maybe make an escape attempt. That's why we have to be ready. That's why we do what we do in order to try and stop this. Yeah, there's some instances where we're not going to be able to stop someone who's feigning this illness or stop someone from coughing on us, but we just have to be ready, and we have to realize what the dangers are, what the threats are, and we have to be ready to meet them each and every day. That's what corrections does.
Well, Dana,
Russ, are you saying that there's no sternum rub for the COVID, like we do for those guys who are all those inmates who have seizures all throughout our facility? So
I'm gonna plead the fifth, but I'll tell you, I've done my share of sternum rubs.
Well, wait, can we just explain what sternum rubs are? Because I have no idea what you guys are talking about right now.
All right, so I will explain. I'll do the best I can. Russ can help me out. But basically what we're saying is if someone is having a seizure and you want to believe that they are, and they're unresponsive to conversation, they're unresponsive to you talking to them, you can take your knuckle and you rub it along their sternum like this real hard. And if they're not having a seizure, they will respond in a hurry. So it's a way to indicate whether someone might be not so honest when it comes to having a seizure. Russ, would you agree? Is that a good explanation?
That's a great explanation. Another one that I used to use when I had a particular inmate that started feigning his seizures all the time was I started bringing in a few little capsules of some smelling salts. And if it's a real seizure, they won't react to that. This guy always reacted.
Yeah, that's what I'm known to used to seeing is the smell. Yeah, you can't fake that.
You can't fake that.
Hey, John Hedonist said that he dealt with what we're talking about right now. He says, hey CO, I have chest pains, or my cellie's having a seizure. So he's aware of the games that inmates play, but also some sad news. He said that his intake officer got tested positive for the coronavirus. So guys, if you're an intake, and obviously there are some times where you're going to have to take inmates in, even if we're limited on movement. I mean, emergencies do happen. Those officers in intake should definitely be having full protective equipment, and also the inmates coming in should be wearing N95 mask. I mean, would you guys agree to that? That those intake officers definitely need to have that PPE gear on at this point? Greg, you want to go first?
First line officers, first line medical staff, absolutely. If there's any availability to have those N95s and the PPE, if we're short on it throughout the facility, absolutely the first line intake, whether it be admission and discharge, whether it be intake in a new facility, whoever is the first people coming in contact, they've got to have that equipment first. I'd love to have it for everybody, but we just have to know who's got availability, and they need to have it first.
What's your thoughts on that, Russ? Same thing, right?
Oh, absolutely, man. We got to be getting these people the equipment. The other day, as day before yesterday, I took a foray into town and went to the U.S. Postal Office, and I went inside there, and you know what? Every one of those people in there was wearing masks. I asked them, hey, where'd you guys get your masks? And said, oh, you know, our employer here, they supply them and everything. Why aren't we doing that for correctional officers in some of these places? That's what I want to know.
Yeah, you know what's funny? I'm starting to see it in the grocery stores. The workers are wearing the N95 mask or just some type of protective gear. And again, I always look back to say, well, I wish, you know, we had that for our frontline correctional officers and those that are working in the correctional system, even our food service workers, the essential employees that people may not realize. Yes, you have the correctional officers. Yes, you have medical, but we mentioned before, you also have food service, maintenance, classification, mental health. I mean, you know, there are a lot of essential positions in corrections that still have to run on a daily basis. Hey, Dana asked a question, and I want to get to it real quick. Dana mentioned something was, how do you avoid complaints for violations of the Sixth Amendment if you stop movements? You know what, believe it or not, what should be understood, and I think this is where a lot of us get these concerns, but I'm telling you something, because you even have the ACLU. The ACLU is pushing for inmates release, and I don't know if they understand how complicated of a process it is. I think they just kind of want that universal release, not realizing that this doesn't just happen overnight. There's a process here. You know, you have to really make sure that, you know, you're vetting who is being released. And it's funny is because as they're pushing for this release, I'm going to show you a video of what happened in Lansing Correctional Facility later on, where you have inmates just pretty much rioting using the coronavirus as an excuse, because again, you have people from the outside saying that we can't handle this stuff on the inside, and that just motivates these inmates to do foolish things because they figure, well, you know what? The public's going to be with us on this. The public's going to support us. So they start acting crazy because they feel that they're going to get that support from the outside, which makes it very hard for us because, you know, they're motivated now. Social media is killing us. Like, I just wish we could, you know, inmates, if they did get the contraband phones, we were able to have some technology up that just, you know, they can't broadcast out. But when they go on social media, I mean, they get thousands and thousands of viewers within a matter of minutes. And it just motivates the inmates to keep doing foolish things. And staff now has to deal with inmates that feel that what they're doing is correct. You know, so when I show you this video, I mean, there's a lot of videos. I just took a 6-minute video real quick. You're going to see what it is that we're dealing with now, because people are pushing from people from the outside are pushing that, you know, this, you know, we can't handle it. And, you know, these inmates are going to die. And they're not really understanding that, yes, there's a concern, but we're addressing it. We're taking it as it comes. But as you start coming up with these sensationalized stories, this video that came out of Lansing Correctional Facility is actually showing you what those sensationalized stories are doing inside our facilities, how it's motivating these inmates to literally take over a whole unit. This riot started at like 3 p.m. And for what I read, the articles, they couldn't get these inmates back in till almost 1 in the morning, which is, you know, what is that, 10 hours later? You know, over 50 something inmates involved. And again, I'm only going to show you one video, but there's a series of videos that are out there. And if you look at the comments, they're being motivated by people from the outside that just don't understand what it is that we do or what it is that we need to do. And the problem is that motivation is now making it harder for us to control. And they're talking about, yeah, you can't social distance. We have all these inmates right now. They're, you know, they don't care about social distancing at this point. They're all connected and they're destroying thousands upon thousands of dollars of property. But again, we'll go ahead and get to that video. But at one point, what I would like to think, universal precaution means that if you have to protect everyone, then sometimes, I'm sorry, guys, the rights of one doesn't matter. If I have to protect, if I have a murderer in my neighborhood, and all of a sudden I tell everybody, I'm the local police, and say, you know what, guys, I don't know where this murderer is. I want everybody not to leave their house. I'm locking everything down. At that point, you guys got to realize something. Your right to leave the house, to me, is superficial in regards to the fact that I want to keep you alive. So I'll go with Russ first. But Russ, even if someone was to complain that their rights are being violated by the way we need to handle at an extreme level, because it is extreme at this point, how we have to handle this coronavirus threat, what would you say to that?
Well, I think the simplest thing to explain or talk about is the fact that it's an emergency situation. It's not a situation where they were deprived of their rights to speedy trial and all those things. It wasn't planned. We didn't seek to deprive them of it. There was no conspiracy in it. It was just an exigent circumstance, and an exigent circumstance led to having to lock the prisons down, having to lock the economy down, having to take all of these measures in order to bring it under control. All right. So the Constitution and the amendments to that Constitution are all about, stopping the government from doing things, right? And in this case, it's not something that the government has control over. They're having to take these measures in order to get a handle on the virus. So there's no, to me, I'm no legal scholar or anything like that, of course, and stuff, but I can see the common sense and just understanding that this is something where we're not meaning to do it to these people. So, you know what? It's kind of just, it sucks to be them, but we're eventually going to come out of this on the other side at some point and start moving the chains and start getting the process, the due process, the court system, all of the scheduling dates and stuff, all that's going to come back around. But they just need to hold their horses, because that's the first thing they do. That's one of the first cards they always play is it's unconstitutional. It's a violation of, my First Amendment or my Sixth Amendment or my Eighth Amendment. And you know what? Sometimes it just ain't so.
Hey, would you agree with that, Greg? I mean, when you have people that are pushing lawsuits against practices without them really understanding why those practices are in place, don't you think that hinders our ability to protect and serve?
Absolutely. We have to remember, and I think Russ was getting to the point, and he was about to say it. The United States Constitution is a living document. This is not a set in stone. This isn't Moses coming down off Mount Sinai with 2 stone tablets. There's your Easter reference. Coming down, and it's locked in stone. It is a living document. The Sixth Amendment was ratified in 1791. There's no way the forefathers had any recollection or idea that there would be a need to have to delay everything due to a pandemic. So we are going to take the rights of the whole over the rights of the one as we look at not infringing upon everyone's health and concern. So county facilities have dealt with this. I don't think it's going to be a big deal. We're going to hear from a few loudmouths along the way, but we need to hold the health and safety of the judges, the jury, because it's a right to a speedy trial. We can't hold a trial because we can't get a jury together. We can't put 12 people, sequester them in a room. We have to, unless you're talking about the Duggars, you can get that whole family together, but we have to make sure that we are making sure that not only are the rights of the offender, in this case, his First and Sixth and Eighth Amendments and what have you, but everyone else's rights. And in order to have a speedy trial, it's more than just the offender. It's the witnesses, it's the jury, it's the judge, it's the stenographer, and everybody else. So no, we're going to have to put that on hold. And there is no regulation that says what a speedy trial is. So in this case, just sit back and relax for a couple of weeks. We'll get you on trial when we need to.
Yeah, and then I agree. I just wish that what happens is people don't get so nervous about the lawsuit that they forget that what we need to do. You know what I mean? Like, I hope they don't start worrying about the lawsuits that are to come and say, okay, well, hey, right now you're worried about a potential lawsuit when it's messing with our ability to protect and serve. So you're worried about the lawsuit that maybe one may try to bring up, but ultimately there are going to be many if we're negligent. And those lawsuits, if you think that they're going to be anything of importance and you're acting on that now, we're going to become negligent because we're going to fail to do what needs to be done because we're worried about that one inmate who, or the one lawyer of that inmate who's saying that, their client needs to be let out, needs to go to rec or whatever superficial thing it may be at this time. Also, Charles Duffy says medical at his jail has 4 negative airflow cells. They're all now full. Where do we put the new ones? Again, it all depends on the layout of the jail. That's one of the concerns. That's why they're trying to do these releases because, they're afraid of that overflow. And again, you want a room that has negative air pressure because this thing travels in the air. But I don't know if you could designate a unit. Like right now, what you need, what a lot of facilities have been doing is that, outside of the infirmary, they've been designating a certain unit or pod that's kind of isolated from the other areas. And when an inmate has symptoms, they get isolated. They get put into that pod and hopefully until those symptoms just die out. Whether they're testing the inmates or not, I can't confirm or deny. I think if the tests are rather very limited, I think what's happening is a lot of people may have symptoms. And as long as the symptoms aren't life-threatening, they put them in an area and they wait for the symptoms to die out. But again, I can't confirm or deny. I just have a feeling that that may be the case at some facilities. But what's your thoughts on that, Greg?
Well, unfortunately, the number of facilities I've been to, like I said, I've been to several hundred facilities. I have an advantage over some people in the sense that I do get to go all the different facilities. There are not that many facilities that even have 1 negative airflow quarantine cell, let alone 4 or 5 or a whole unit. You're talking jails that have just been neglected because county officials and the money just isn't there. It's not sexy or pretty to put money into jails. So you have to pick a unit. You're going to have to find an area that is sequestered enough, and you're going to have to designate groups of beds. And that might be a general population. You might have these guys sleeping in upper lower bunks next to each other in a group together. That's the nature of, unfortunately, of the jails in the poor condition that we've got in some of them. If you have the ability, then by all means, utilize a segregation unit that has doors that you can put these guys behind for a period of time until you see whether the symptoms come or go. But you'll see, even in the video that we're going to watch here in a little bit, the unit that these offenders are in, it's not at all a negative airflow. It's an old school facility with bars on the doors. So you're just literally putting them in cells on tiers. That's you're not really quarantining them in this particular case.
I may have a surprise guest come on, but don't quote me. So I don't want to say the name yet. But someone's texting me now, may come on. So we may have one other person coming on, but I'll let you know once they can confirm. Hey, Russ, but what's your thoughts on, obviously, if we're running out of spot, if we could designate a housing unit, we could designate a housing unit. I mean, at that point, do we have any other choice?
Yeah, well, it's obvious. We're at the point where we're at, and we're going to have to start, taking over some specific areas and identifying them as, okay, this is where we're going to put those COVID positive people until they get through the progression of their disease and we can pull them out. Now, a couple of the bright spots that are on the horizon, though, and I don't know if this is going to eventually be deployed to any correctional places or not, but just looking at what I was, Googling earlier, a company called Abbott, now they're putting out a 6-hour test, and they're also putting out a 15-minute test. When these point of contact tests start coming online, if we start getting these in some of the facilities and stuff, it's going to change the way we're able to operate, because we won't be having to put people in quarantine just on suspicion and then having to wait for that test to come back in 2, 4, 6, or 8 days. So hopefully that's going to be some kind of relief that we're going to see, and we can start operating at a faster pace and getting ahead of the virus faster and faster. Now, I don't know for sure that any of that's going to get deployed to corrections, because how we're, the last stop on the chain of everything, but it is one of the places that they should consider to place it first, in my opinion.
Right. And I want people to know that, even though we have the coronavirus going on at facilities, the facilities are still having other problems. In Georgia, a North Georgia inmate faces additional felony charges after being accused of resisting jail officers, leaving one with a broken leg. Michelle Cutright Cox, 23 of Taylorsville, is accused of breaking the officer's leg Sunday in the Floyd County Jail. The incident led to a charge of felony, aggravated battery on a police officer, and counts of both felony and misdemeanor obstructions. Hey guys, that's another thing, guys. What people don't realize is correctional officers, I know police can avoid to give a ticket, but correctional officers, they can't avoid these interactions. I mean, they're going to have inmates fighting in cells. They're going to just have, inmates that are going to just do what they do. And they're going to have to be able to put their hands on them. And obviously that's got to make them nervous. That's got to make them a little hesitant when they go to respond to a code and, the inmate's bloodied up and there's just, fluid everywhere. I mean, I haven't been frontline for a while, but I know how it would feel. I mean, if you have inmates that are fighting and you know that you're going to go in there with that PPE gear on, if you have it, God forbid that you don't have it. I mean, that's my concern right now is if you don't have the PPE gear, how do you expect the officers to get involved when they have to put their hands on an inmate? Russ, you want to go first?
This is one of those situations where, because of someone else's poor planning, we on the front trenches and the front lines and stuff are the ones that are having a bite on the bullet. I've responded to, hundreds of incidents where, you were questioning what the guy's health was. You were questioning, whether he has hepatitis. I was in a critical incident years ago where my partner got his finger bitten by a guy who was hepatitis positive. And so, it's always lurking there in the back of your mind. Now it's really kind of, taken front and center. It's in the front of your mind because you're hearing all these things. You've got inmates that are testing positive. So, people should be protecting us better. The service that we render with regards to staying on the front lines in the face of an adversary like this, I mean, it takes a tremendous amount of, guts to be able to stand out there and do this day in and day out. So, my gosh, administrators, get your people some damn equipment, please.
Well, you know what this reminds me of, Greg? When fentanyl was a big thing, it still is, by the way. I don't know why I said was. It made us hesitant to respond to inmates that could be having real medical concerns because we didn't know if it was a medical concern related to, let's say, their heart or whatnot, or if it was white powder that we could eventually be affected by. So, and that's the only time we really started becoming hesitant because, again, inmates that are overdosing are having the same effects as if they're having a heart attack. So I see that here too. You got these inmates that, are fighting or doing whatever, and you're going to have officers that are going to be hesitant. That's why we have to do what we can to protect them because that's going to motivate them to step up and do what's necessary. But what's your thoughts on that?
In the number of codes, as we call them, or conditions that I responded to, we can all relate and think back to the number of times. How many times did we hesitate? Obviously, I would say the three of us probably could count on one hand the number of times we ever hesitated. I remember getting chastised as a new officer for jumping into a fight before I waited for backup. So yeah, you're always that's always in the back of your mind, but nobody's going to stand around and wait and get the gloves on, get a mask on, get the gown on before you jump in the middle of a fight. Most officers just handle it. I think that this leads me to thinking about what are the other tools in our tool belt. Obviously, I know from some outside experiences I have at the USDB in Leavenworth, as a matter of fact, they don't have OC, they don't have tasers, they don't have batons. All they have is their mouth. So they use the tools of the trade, verbal judo, and they be able to talking down and human respectful communication, things like that. That's how they talk them down. But in a lot of these cases, you don't have the time to do that. So our officers do need to be equipped, whether it be tasers, whether it be OC. We need to be able to have hands off and still be able to quell a situation. We can't go hands on right now. It's too dangerous. It's more dangerous for me to break up a fight as it would be to just tase a guy. and I'm not trying to be flippant, but I'm just telling you, if I walk in and say, hey, fellas, you need to knock it off or I'm going to tase you, they don't stop, taser, boom, I'm going to shoot you from 6 feet away, as opposed to stepping in, or I could get blood or spittle or spewed on or whatever. We have to think of our safety. And I know it's we really have to put our safety aside. We do every day, but right now you're talking about the long-term effect of jumping into two guys fighting, and one of them very would possibly be a carrier.
And guys, by the way, me and Russ, we're doing what we can to make sure this channel grows. And sometimes that requires us to break bread with someone who's doing the right thing, but may have spent time on the other side of the bars. And I'm going to probably have someone come on shortly who was on the other side of the bars. They're coming from Maine. I'm trying to get them to come in now. And they're going to give also their perspective of how the inmates feel. But this is a person that also believes in what we do. He has a very good relationship with I think it's his parole officer. And I believe he's someone that can add value to this dialogue. And I think this is a way for us also to expand our audience and for people to see that we're more than what these other prison channels think we are. So, we're always fair with our audience, and I'm waiting to see, but it looks like he may want to come on. So if he does pop on, I'll introduce him as the show goes. I want to mention something, because before we get into Lansing as well, I don't know if people realize this, but in Monroe, Washington, Washington was one of the first states that were affected by COVID. State and local police brought a large disturbance at Monroe Correctional Complex under control Wednesday evening after a couple of hundred inmates concerned about the facility's COVID-19 outbreak threatened to set fires and possibly take correctional officers hostage. The disturbance began in the prison recreation yard around 6 p.m., according to a statement from the State Department of Corrections. Fire extinguishers were set off in 2 housing units within the minimum security unit, creating the appearance of smoke from the outside. 2 inmates at the Monroe prison described the tense unfolding situation in electronic messages to the Seattle Times. One called it off the hook, saying correctional officers possess these grenades that shoot pellets to control what the hell is going on, apparently referring to sting balls. He added, I'm too old for this shit. It's bad over here again. People are starting to run outdoors, throw food and all. You know what's crazy? A lot of people even think, well, they're minimum inmates. It's not that big of a concern. Minimum inmates are in open dorms. Actually, officers that work minimum facilities, their lives are at risk all the time because it's not as controlled as a max facility. So it doesn't shock me when I hear a story about inmates rioting, especially the number like 50 to 100, and it happening in a minimum area because, again, it's open setting. Hey, what's your thoughts on that, Russ?
Well, I think what we really have to take into account here is you're going to have a limited number of inmates that are going to be trying to leverage this for everything that they can get out of it, whether it's trying to get released, whether it's trying to, punch holes in our security so they can get some drugs or dope or cell phones in or whatever. And they're the ones that are the troublemakers. They're the ones that are the instigators. They're the ones that pump this up. And, they're just selling all the wolf tickets. So if we can control those inmates, we stand a shot at being able to, take the temperature down out of the units and be able to go on. But what you have to realize is you have to be willing, and you have to have the type of officers that can go out there and talk to these inmates and be able to, put the information out there to be able to educate them and to at least, to manipulate the inmates into becoming part of the team, part of the solution, if you will, where you can have them cleaning things and doing stuff. Now, that's not to say that that's going to, solve everything. But what does happen is you can put the inmate population in a position where they're less fearful, they're less likely to go along with nonsense. And that tends to make them want to point out the troublemakers, as long as they feel that we're in there and we're trying to get them the help, the attention, the medical, whatever they need.
Hey, Russ, Dave had a question real quick. Dave mentioned, I guess when you were going over your comment prior, he said, oh, okay, maybe he couldn't see you. I thought he was asking you a question. All right, Dave, I apologize, Dave. I apologize, Russ. I thought he was asking you a question to answer. And hey, Russ, real quick, Trevor Pierce says our inmates have no issues. We have pretty good rapport with them, but we haven't had issues with them getting upset. I'm sorry, I'm reading this wrong, guys. You got to forgive me. I thought someone had a question for you, Russ. Guys, I apologize. Russ, you want to finish your thought, or were you complete?
Yeah, I'll go on just a little bit. So, as we do this, as we try and, get the inmate population into a position where they are less fearful and that they are going along with the program, it really benefits us. Now, we also have to, fill out and balance the other side of that equation where we have to maintain our readiness. We have to be ready to react tactically if necessary on this. But I think in the long run, prevention is where it's going to be at with this thing. You just can't simply let those things sit in there and, idle and boil and let that temperature go up and not try and do something to head it off.
I obviously I agree, Russ. Hey, Greg, what's your thoughts on that?
I think communication is key. Russ is absolutely nailing it on the head. We've got to be able to talk to our offenders long before this happened. If we're in a position now to where the offenders are not talking to us and turning on us, I get that, but we need to have established that rapport long ago. I talked about it before, that human respectful communication, that's talking to them. I have often said that the only difference between me as an officer and the men and women that I have taken care of on the other side of the bars, the only difference is somewhere when I was a teenager, I turned left, they turned right. I mean, that's it. That's the only difference. And there's no difference between them and I, except maybe a car I did or didn't get into. I could absolutely be on the other side of the bars at any time, and you have to treat them like that. And if you establish that rapport with them all along, you have a much better shot of being able to quell these situations. And I honestly believe, and we're going to talk about this in a few minutes, you're going to see that in the difference between the Washington riots you just talked about and the Lansing riots. There's a key difference there, and we'll talk about that here in just a couple minutes.
All right, so I do have someone else that entered. Let me just make sure I get his last name right. Hey, Chris, how do you say your last name?
Graffum.
Say it again.
Graffum. Sorry, it's a cheap setup. I mean, I'm bottom of the barrel, but I'm trying.
No. Hey, first off, the reason why I wanted to put you on is, first off, all the good that you said that you've been doing. Like, obviously, you're doing stuff, you're changing your life around, but you also came out very respectful to what we're trying to do here on the show. So in return, I also respect you. And it's actually good to see someone like yourself making that change, because you're going to have a better influence on the world than we would, because people will know that you talk the talk, but you also walk the walk.
That's why I'm here, because I feel that it's important that you guys do get my side too, because I don't want you guys to be scared of us when we're scared of you. You know what I'm saying? And I don't want you guys to come in and kill everybody because you guys think that we're scared, and we're trying to do the same thing because we're just trying to think it out too.
Well, Chris, let's hear a little bit about yourself. What can you share with us?
So I grew up in Maine, fisherman and all that. Fell off a roof roofing in the wintertime, broke my back, got addicted to Oxycontin, and I became the man. I blew up, saw shit tons of it, had guys from New York running it, all that. Ended up getting my ex-wife involved, lost my family. She got addicted to the money, I the drugs. Long story short, she got a new man. I whooped his ass, and I whooped it bad. So I got 5 years for aggravated. Did 2 counts of aggravated assault. He was a fucking liar, but he'd already done prison time, so he knew if he said that I fucking tried to fucking, sorry for the language, it would give me that rap sheet. You know what I mean? It would make life harder for me. And it did. Believe me, it did. But I got through it, right? So can these guys, but you guys got to take the people that they can relate to. And that's who you got to get to tell them. That's your respect.
Let's do this. Let's do this, Chris, because I'll introduce you to my guys I have now. I have Russ Hamilton, who's got almost over 30 years in the business, worked at San Quentin, juvenile justice. I mean, and then obviously we do Tier Talk. We have Greg Piper over here, who was a captain for Kansas City Department of Corrections, also is in charge of training for one of my sponsors, Guardian RFID. And one of our concerns right now is that, and it's why it's good to have you on, I just want to get your perspective, is that, obviously the coronavirus has us all concerned. Obviously it's an invisible threat. It's something that we're not used to. And this is the first time where, in my mind, I believe that custody and the population actually share this one major concern, but we need to have control. We need to have a way that the message is delivered to the population and staff where we break away from what's sensationalized and we give them the truth, because again, the news is going to run on extremes. So how important for you is it right now that staff communicates with the population? I'll start with you first.
How
Chris.
important is it to you guys? That's the real question, because you guys are the ones that are getting paid minimum fucking wage for your time and your lives. I'm just stuck there. You know what I'm saying? I was stuck in a place I didn't want to be. You guys get to go home. Them guys just want to go home, man. That's all.
So let's start. Well, let's start with this first. Hey, Russ, before we show the video, Russ, because one of the questions we had today was, how do we think the coronavirus is going to affect the safety and security of the facility in regards to inmates uniting? And again, we saw that we hear about the riot in Washington, and we also hear about what happened. And I'm going to show you a video at Lansing Correctional Facility. But how important is it right now for us to get that message out there? This is what's real, and this is what we need to do to protect and prevent.
I think the thing that most of our listeners and viewers realize, but some of them may not be as hip to this. There's a lot of different levels and strata within a prison or a jail system, where at the very top you're going to have some shot callers and ones that are really involved with the gangs and so forth. They're going to try and take that leverage that they can with all of this fear and stuff going on, and they'll play staff against certain inmates, and they'll try and cause as much disruption as they can. The reason that we have to get out there with the communication and start talking this stuff down is a lot of these inmates just really don't. A lot of these inmates just really don't know what's going on. They see what they're being told on TV. There's a lot of hyped up and pumped up things that go on with our news media, and they're kind of blowing it out of proportion. And that feeds their fear, because these inmates, they're not out there seeing what it's really like, but they're being told what it's like. And that kind of feeds a circle, and that kind of puts us in a position where we have to influence them. We have to educate them, and we have to take that temperature out, and we have to try and deal with the shot callers and not let the shot callers use this to start the problems, because that just feeds it. And then we end up with these problems where we're having some major incidents there. So number one is communication. Number two is being able to be either proactive or reactive and be ready to take places back if it all goes bad.
So
hey, Chris, I see you shaking your head. What's your thoughts on that?
What's your plan there? Are you going to take the shot callers out of the pod and scare the fuck out of these kids, or are you going to talk to the shot callers?
I think it's on a case-by-case basis, but I think for the most part, what you have to do is you have to take the temperature out, and the shot callers will not maintain influence in a situation where there's fear, as long as you can kind of distribute out that information to the rest of them. Like everything else, sometimes it's on a case-by-case basis. But if you try and take that fear and tension out from underneath, it doesn't give as much for the shot callers to be able to leverage against everyone else. And you try and make that, for lack of a better term, you try and make that unit function as normal as possible, and just not let all the fear that comes in from all the pumping up that goes on with the media and stuff coming in.
I do agree with you, Russ, because there have been times where, like, if there were concerns, we as supervisors used to be able to talk to the shot callers and kind of, I'm not saying we need their permission to run things, but we tell them, hey, work with us on this.
You do.
You know what I mean?
You do, because they live there. You have
No, but
to, because they live there. You're just trying to boss them around. That's not the answer, man.
No, what I'm saying, Chris, is this. Chris, listen to me. Hear me out. What I'm saying here is this, is that most of the time, let's say with this coronavirus thing we got going on right now, they know that we have to have a level of control. They also know that we have the ability to handle the situation if, I'm not going to say that they allow us, but if they keep the people that are trying to run things amok
Use
down.
your tools wisely, man. Them shot callers are them guys keep you guys alive every day, and you don't even know it, because they're the ones running the pod. You're just sitting there keeping an eye on things.
I'm not gonna. We may not agree on that.
You
I'm
just
not
gotta pick the
100%
right
on that.
ones. You gotta pick the right ones, man. That's
All
all,
right,
man.
I agree. Like, listen, here's what it is. Okay, in my experience, I've always had working relationships with the inmates. I knew who my leaders were. I knew who my shot callers were, and I always gave them a bit of respect, but not because they led things. I respected them because of how they treated me. You know what I mean?
And
So
that's why they respected you.
yeah,
That's
and
why
I
they
agree, and
respected
it went
you.
both ways. Same thing with Russ. Same thing with Greg. So I think at some point, what we do is if there are inmates that have influence over others, then if you want to work a dialogue with them, but the key here is that that dialogue also is to show where the authority is. Like at all times when I deal with the shot callers still respect the fact that they know I have this level of authority and they know that there's stuff that's expected from me. But what I do in return is that there's information that I feel can educate them and give them a better understanding of what it is we're going through. I may give them that information because it's needed in the hopes that they can go ahead and share that information out to their individuals who follow them blindly. Because at this point right now, if we're running on bare minimal staff and whatever it is, those shot callers, they know in the time that this is where we're vulnerable, this is where we're weak. But again, I'm not dependent on them. I'm never going to be dependent on a shot call, because any day, to me, yeah, they may have some leverage, but having said that, and I've been in the system long enough, Chris, having said that, if I feel that I have to have a plan and they're not helping me with that plan, we do have the power and the authority to do what we got to do to limit their power. You know what I mean? To move them out of that facility.
To get there to do it, bro. You gotta wait to get that. You gotta wait for your boys. Our boys are already there in the pod.
Yeah, but I'm not everything's physical though, Chris. Not everything's physical.
Hopefully
Like,
not, man. I that's the worst case scenario ever is physicality.
yeah, but I don't know if we're on the same page here, Chris. You gotta bear with me here.
I understand what you're saying, and
yeah,
and sometimes you do gotta take away the power, but them same guys are the ones that the people underneath them listen to, and they're the ones that they need for guidance right now. Those are the strong father figures, so to speak. That's the one thing I had missing out of my life, my whole life. My father died in '91. I went to prison and I hung out with the old dudes. I stayed away from the kids, and I learned how to be smart while I was in there. I went to school. I got my high set, working on getting stuff ready so I can go to college. I mean, I never thought I'd be sitting here talking to you guys like this in a respectful manner.
yeah, but you were respectful in the chat. That's why we're telling you, because I know ultimately you have a different perspective. But having said that, you're being respectful with it. That's why we're open to the dialogue. Hey, Piper, what's your thoughts on what me and Chris are trying to get off?
Well, having been a unit supervisor, I started off as a tier guy, and then I was a staff sergeant running a unit. I think you both have a really good point in the sense that Chris is saying that in order for me to get my job done every single day, in order for me to work with the offenders, I need to get their respect. One thing I hear from
security.
The one thing I heard from offenders over and over and over again, and Chris, I guarantee you're going to agree with me, is offenders would always say, "You respect me and I'll respect you." And I had the exact opposite. I would say, I'm going to respect you regardless. Why? Not because you earned it, but because I'm a professional. I'm a gentleman. So I gave my respect.
Than me. You're smarter than me.
I just give my respect to every day to the offenders. I refer to them as Mr. I always said sir. And why did I do that? Because you're a human being and I earned the respect. And so you have to earn the respect and then you give that respect. But those OGs, those shot callers, those podfathers, they knew that about me. But that doesn't work with every officer that walks in the door. Every Johnny come lately who's 9 feet tall and bulletproof, thinks he's going to run something, has got to learn you have to give that respect. But to your point, Tony, is that we still, as a correctional facility, have to have the mentality of we do have to run this facility regardless of what the offenders are going to do. So yes, it is our facility, but it is definitely a mutual situation. It has to be a symbiosis. We have to work with them because you said it, Chris, you guys live there, we work there. And a prison is a whole different world. But if we're not learning the animal that is our pod and we're not growing it every day, then we're not doing our job.
Who knows it better than the shot caller? Ask him about it. He'll tell you.
Yeah,
ask
by
me
the
right.
way, Craig agrees with both you guys. Craig agrees with Chris and Greg. The point here is this though, is that there is that respect. I agree that I'm not negating that. And there is some things where I would say, okay, hey, listen, guys, work with me on this, but there's no way that I'm going to be obligated to that individual either. So what I'm saying is yes, there's a mutual respect. Just like if they need something, if it's within my means, we'll give them. If they're allowed to have that, they'll have that. But with that said, is I'm not going to the inmate in a position where I need them. I refuse to do that. I'm sorry, whether they're a shot caller or not. I don't feel obligated to the population. All I'm saying is work with me, because if you don't work with me, then that's where the problem is. But the problem isn't on my end, because I have the means to maintain or enforce that. So,
Right,
hey, Russ, what's your thought? Russ, are we seeing things on the same page?
Yeah, I think so. What happens a lot of times is there's a practicality sometimes towards where we have to go, and where we end up meeting, and it's always a back and forth. And so there's a lot of times where I'd be running a yard with my officers and stuff, and we'd have X, Y, and Z shot callers and stuff. And you know what? Sometimes, you just have to make the best of it, and you have to keep those guys in the loop. You have to, ask them what their input is. And you know what? We might never actually agree on much, but sometimes what we could eke out of a situation would be the ability to, keep the yard functioning, keep the yard running. And you know what? And, sometimes some people's pride gets a little bit hurt, no big deal. We just pick it up and move on and go in for another day, and then work the next shift and try and get the next set of programs out and do the best we can.
They
And
wanna
Chris-
listen to you guys, they just can't hear you yet, because it's not the shot callers telling them, man. It's not the people they trust telling them.
And Chris, obviously a lot of people do agree with you. They're saying that right now, if anything, that rapport between the inmates and custody really does matter at this point, because obviously, the potential for chaos could happen at any moment. So the officers that are giving out the information have to be officers that they respect.
The
So
men don't want to hurt you guys. They just want to take care of their families, and right now their families in there with them. And you're
So let
trying
me
to
ask
keep
you a
that
question,
away.
just out of curiosity. What type of officers did you respect when you were in Maine?
The biggest assholes I met. No, no. It takes an officer with a lot of kindness and understanding that knows that somebody might be a dickhead, but they're a dickhead for a reason. They've been through some shit. They've been through some shit you don't know about, right? Because nobody asked them.
Right, but obviously you do expect the officer to follow what's expected, to keep things consistent, to keep things fair, to keep things firm.
Do you know why that shot caller can keep them boys in line? Because he knows every fucking thing about them that you don't.
All right, so what was that, Russ? You dropped something?
No,
Is that
I
the thing you need to
hit
borrow
my
soda?
mirror. I hit my
Oh.
mirror. I'm stuck in the back room right now. I'm not allowed to come out to the front for a little bit.
Hey, at least it ain't your grandma's living room, boss.
That's where you're at?
Something like
That's where I'm at. She's 78 and she needs help, so I'm here, man.
Well, you're doing a good thing. You're doing a
I'm
good
trying,
thing.
I'm trying. I got a lot of opposition, but I'm holding tight just like you boys are, man. It ain't no different. We're all on the same team, man.
Yeah, and we're spending Friday night together. Now,
Hey,
I'm gonna.
what else do I got to do? Go out and do heroin? Fuck that shit. Come on, man.
Well,
Life
let's.
ain't about that. It's about family.
Well, here's what we're gonna do, Chris. We're gonna show everybody a video. It's about 6 minutes long. It's coming from Lansing Correctional Facility.
I think I
This
just
is
saw
what
it.
happened. You probably saw it already.
Yeah.
This
That's
is
what
what
I did.
happened. I believe it was Thursday. Started with about 50 inmates refusing to lock in. There's multiple videos out there right now, guys. I just did this video because it's 6 minutes long. And basically, they're concerned about the coronavirus, or that's what they're saying. And now, unfortunately, there was a riot, which didn't wind up. The last inmate was wind up being brought back in and controlled, locked into their cell around 1 a.m, which was this morning, Friday morning.
What
Okay,
are you
guys, so I'm gonna.
comparing this to them. What do you guys like? Are you telling them it's like staff, or what are you guys using to give them a reference point from?
Wait, what do you mean? What's that question, Chris? I
They
apologize.
need a reference point. They need to know what they're dealing with. They don't know what this is. It's never been here before. We don't know, right? Nobody.
Well,
knows.
one of the things that we were mentioning before you got on was the fact that the key right now is having that communication between those that know, bringing it down to staff and the population. And again, if they respect the staff, the information could be calming, because believe it or not, there is a level of control. The news is sensationalizing a lot of it, but I agree with you 100%. You know, it is about that rapport and who they get that information from. So that's one of our balances. We're making sure that the right information gets to the population so we're able to maintain control. But we need to be, I do agree that we need to be obviously honest with staff and inmates. So,
And you know what I wouldn't do? I wouldn't cut the cable. That's for damn sure, because that's all they got keeping them calm.
oh no, trust me, keeping those TVs on. Okay, so
Keep
hold
them
on.
TVs on, man. You keep them boys busy. That's what you're gonna do. Give them some fucking stickers and let them put it on paper or something. Put it up. Give them a pie. You know, give them something. Give them a prize, man. Give them something to be proud about.
I'm going to show the video real quick,
in
so
the
stand
park.
by, guys. Okay, hold on. I'm going to show a video, guys. Hold on. Oh shoot! Found a rock. They trying to shoot up. Oh shoot! All right, guys, so that's just a little bit. Let me close this video off. Hold on. That's just a little bit of the video. So I'll go to Greg first. Hey, Greg, what's your thoughts on that? You're familiar with that facility.
I am. So it appears that this is Pod C, which is one of the many pods, holds about 150 offenders, 3 tiers. I'm pretty sure from what I read, if I remember correctly, that's a minimum security, or excuse me, medium security area. I think the most of the footage you're seeing is actually from a corrections counselor's office. The corrections counselors in the state facilities, I don't know how it is in every state, but I know in Kansas, are the integral piece that the offenders have. They're the people who help with their release plan, their good time awards, getting them jobs, details, helping them with their accounts, a lot of different things. Really, really important. So just destroying that office just set that counselor back, you know, in general, just all his records and everything. But one of the things I noticed is the difference between Washington that you mentioned. We don't have any video from, but the Washington inmates said, in the state of Washington, said that they were going to take officers hostage to prove their point. You'll notice in this video and in the following, you know, in all the statements made by the Kansas Department of Corrections, no staff was harmed and everybody got out before they even started filming. So you'll see the differences in Kansas. They were trying to prove a point. Just like Chris said, they were trying to prove the point of, hey, we can do this. We have control. But they got all the staff out of there first because they didn't want to hurt anybody. Nobody was causing them a problem. It's not the staff that was causing this problem. The inmates are scared. They're concerned. They want certain things. Later on in the video, there's actually a letter that they have signed signatures attached to it saying their demands or what have you. So they were actually doing it. You don't like the fact that they caused a riot. I don't like the fact that they caused all this damage, but they really played the only ace they had in their hand by having a riot, but at least they got all the staff out so they didn't incur the possibility of some really serious charges.
Yeah, they don't
Right,
want to hurt you.
Oh, what was that, Chris? I apologize.
They don't want to hurt you guys. You guys keep them fed, man. They can't eat without you.
You know,
what I'm
Trevor
saying?
agrees with you guys, by the way. I don't think they wanted to hurt staff, and I agree with that. In this case here, you're right. They did have staff leave. The concern in Washington was a bit different, where they were threatening to take a whole nother level, basically taking staff hostage in order to get them that release. Also, in Yakima, Washington, you saw a bunch of inmates from a jail leave. I think South Dakota, they had a bunch of females that tried to escape when they thought someone from the work detail was affected. So there definitely is a fear. But let me ask you a question, Chris, before we go to Russ. Do you think the news plays a part into this fear?
That's all I watched the whole time I was in the news, the History Channel, Discovery Channel, just learning, man. That's all we do over there. We're down. We got to come up, right? How do you bring yourself up? You get smarter.
I agree. And Russ, at this point here, do you think, what do you think about the inmates' actions in Lansing?
Yeah, I think that what you really have to look at here is now, yeah, there's going to be some Monday morning quarterbacking, some, hindsight on this. I think that you want your correctional facilities to start getting out in front of this and not let all the fear and tension build up. You need to start going in and start rooting out some of that, start, getting some information to the inmates and start talking to them about what the process is going to be. For instance, if they test positive, these guys are just seeing stuff on TV. They're hearing about deaths. They're hearing about morbidity rates, mortality rates rather, and they don't have any idea what's going on. And then you start picking out an inmate or two that's testing positive, and then they're being segregated away. These guys really don't know what's going on, and they have very little recourse into being able to get to that point and see what's going on. So don't let them feed into the fear. Put them in a position where they understand, okay, if I test positive, it means I'm going to have to be quarantined and I'll be going over to X dorm or whatever it is, so that so that they don't have a chance for someone else who might not have their best interest at heart to get in their skull and say, hey, you know what? We need to make this thing go off. We need to, get some attention here. We need to get on television. We need to get the media in here. That's not what we want. We want ahead of time to be able to get there and head them off so that they understand the process.
Tell them who else is there. Tell them who they're going to hang out with, man. Nobody wants to hang out with the enemies. They want to hang out with their friends.
Let me ask you a question, Chris, from your perspective. What message do you think the population wanted to get across when they were doing that?
They want answers, bro. They just want answers. That's all. You guys asking questions and they know less than you do.
What's your thoughts on that, Greg? You think that's the case?
Yeah, absolutely. They don't, like I said, they don't have any other way to get their information out. There are means, there are ways they can do it. It's just a lot slower. It's very bureaucratic. You want answers, you turn in a kite or a Form 9 or a JPay or whatever you want to call it. I know it's different in different states, and they ask somebody, they have to go through different sources to get questions answered. This was an immediate way for them to get the attention they need. It's not good attention. You got to look at it this way, folks. There's good attention and bad attention, and we all want good attention. We all want the praise, but the difference is, do you want good attention or bad attention? Well, I want good. Do you want bad attention or no attention? The inmates felt like no one was paying attention to them, so the only way that they could get people to pay attention to them was to have this inappropriate but eye-opening situation happen. Now, the downside is it's going to be thousands and thousands of dollars for the facility to get back in line. You mentioned earlier that it took 10 hours for them to get this, to get things under control. What they had to do there, just from a logistical standpoint, is they called in other SORT teams. You call them CERT teams, SWAT teams, whatever you want to call them. They're Special Operations Response Team, black suits from other facilities. They had to be bussed in or flown in, depending on how far away. So they had enough officers to go in and quell that and lock that place down. Now, I have had some contact with some acquaintances of mine. The facility is safe right now. It is on lockdown, but they have extra officers from other facilities all around the state of Kansas helping out. They brought in SORT teams to help ensure the safety, but they had to bring in extra officers. That's why it took 10 hours. They had to get a game plan in place, get a SORT team together, so they had enough officers to take back the pod.
Hey, another thing is that's why you have to take the grievance system seriously. Grievances should never be ignored, even if you have the grievance where the person just kind of cries wolf. You got to pay attention to each grievance, because one thing, that's where liability is, but second thing is that's where the inmates will try to employ their voice. Now, if they feel that their voice isn't being heard through the grievance system, then you have to watch for these extreme measures. So the concern is going to be, it's not to negate or minimize this action, because again, I still feel the action is going to be extreme. I'm not going to change my thought on that. But with that said, I know me, Russ, and you would probably be thinking of is, I wonder what concerns they felt were not being answered, that they felt the need to take it to this level. Because it's a lot different than the one in Washington, where in Washington, they wanted to take people out. They wanted to do whatever. In this case here, they were going to allow staff they allowed staff to leave, or whatever, from what the article says. So I'm wondering if they feel that at any point they had concerns and those concerns weren't being met. I'm just wondering what those concerns would be, because it doesn't look like I don't know if they're asking for automatic release, because that's unrealistic. Most of the times when, inmates take these extreme measures, they try to narrow it down as if the concerns are, like maybe not enough programming, or they barely ever ask to be released from prison. They don't ask for something that's extreme. I just don't agree with this method, obviously.
Where are they going to go, bro? Where are they going to go?
I agree, Chris. The only thing is, again, just my custody background, like, I don't know what led to this point. I'm not going to, either way, I'm not going to justify it either on their behalf, but I'm very curious to see why they felt that this measure would need to be employed in order to get someone to understand what it is that needed to be said. What's your thoughts on that, Chris?
Because you guys know more than they do, and you ain't telling them shit.
You think, what's your thoughts on that, Russ? You agree with that?
Well, yeah, I've gone back to this a couple of different times, and one thing I want to point out that that Chris alluded to earlier, when you start separating these guys out because they have symptoms or anything else like that, they have a lot of these guys, they have a real concern about where they're going to be placed because of the potential for an enemy to be there, for a potential for a rival gang, a rival STG, or sometimes it can be even the fact that if they get put with the wrong crowd, then suddenly they have an obligation to take off and hurt somebody, and then they end up, catching more time. And so if they're not involved in the process, and if they're not, given the information and told, no, look, we're sorting these guys. We got people from classification. We know what your concerns are. We're not going to house you with enemies. Then that's the way it sometimes spawns a lot more stress on them, a lot more unknowns, a lot more fear, and we shouldn't play into that. These guys need to be made aware.
My one question for you guys is when you guys had to call in all them other CERT teams, right? Who was watching the guys' backs that were at those jails? How long would it take your CERT teams to get back to their home positions, to guard their home bases? Because I thought about that. When's these other guys going to think about that? I ain't the smartest motherfucker ever been to jail by far.
Well, I'll tell you something. I don't know how it is in most facilities. A lot of facilities are understaffed as it is. So I don't know if they have CERT teams that are assigned to specific facilities, or if you have CERT teams that are like assigned from central office. So I don't know if they're borrowing from the facilities to assign this CERT, or if they do have like a centralized CERT team that responds. But my concern is right now with limited supply, I'm sure CERT teams are already being employed at facilities even before the coronavirus, because you have facilities like Alabama that was extremely low on staff, and I'm sure they were operating on trust and believe, when you're low on staff, all the staff that have those specialized posts, they're going to get pulled back into their home facilities. So that's a great question, Chris. I would like to think that I would hope to think that right now they're being deployed from some type of centralized region, so it's not affecting the other
Probation
facilities.
officers.
Yeah,
You guys
what
are
is it?
hiring probation officers to become guards, ain't you?
Yeah, well, they're
That's the
also
plan,
bringing.
right?
Well, they're also bringing back retirees as well because the numbers are dwindling.
Old
I mean,
men.
one officer on quarantine, one officer testing positive could take out 25 officers on quarantine.
Oh yeah. Hell yeah. One inmate could do the same to the rest. And that's what they're scared about. It's not
Well,
all about you.
let me ask you, get your perspective on this, Chris. What's your thoughts on the quick early release of the population, knowing that, maybe the threat was coming in, that's fine, we understand that. But what about if you're sending people right back to the streets that could have it? Do you really think they're all going to go get medically checked, do what they got to do to make sure they're right before they go back into the community?
Why the hell would you send them back in the streets without checking them?
No, I'm asking, what's your
Why
thoughts
would
on the
you send
early
them back
release?
without checking them first? You guys already have them there. You can check them on the way out the door, bro.
So would you expect them to be quarantined at least for 14 days before they get released?
Why not? They've been quarantined this long. Might as well keep them another couple weeks. What the fuck's the difference? It ain't
And do you
no pain
think
to
some,
them.
and Chris, do you think some people would argue about that? They were getting released. Do you think some of them would argue about having to stay the extra 14 days?
Fuck yeah. Because they're too dumb to realize it's better than staying for a month.
All right. So, hey, Russ, let me ask you a question real quick. I know we're going to probably come down to a close soon, but so right now, I think that we got that, some of these, again, not to negate or minimize the actions. I'm not going to condone that. But you think obviously a big part of maybe a big deterrence to this is definitely that communication. Definitely, and then I like what Chris said, balance that communication with officers that they respect. How you think that goes a long way, Russ?
Yeah, that's what we're looking to. The position that we're about to end up in here, whether we want to or not, is that we're losing officers that they're no longer able to function. They're in quarantine or whatever. We're having to get by on fewer and fewer staff, or we have staff that are being strung out and having to do doubles or triples or whatever. None of that is healthy for us. None of it's good for the inmate population because we get to a point where we can't protect them either. We just want to be in a position where we can
going
negate
first, the
stuff
weak ones, right?
and get through to the other side. So, I'm a real proponent of that because the way things are going right now, we're dwindling away, and we don't need that. We have to stay on top of that communication, and we have to be ready. So
how many men you got
anyway,
in the pod?
that's just my perspective.
Hey, Chris, let's do that. Hey, Chris, hold on. So it's hard when he speaks, it's hard for him to hear you. So what was your question to him? It's all right. What's your question?
Mexico takes inmates and they make them guards. It might not be the answer, but hey, it's working for them, right?
Yeah, but we're not going to do that here.
I know you're not going to do that.
But what was the question you asked about the pods?
How many people are in a pod there? Like each pod has its own world dynamic. It's its own country. You know what I'm saying? Every pod has its hierarchy. It's got its king all the way down. It's trickle down economics to its basic degree. I never had shit for money, but I come out with tons of tattoos and stuff. And I didn't get shit for write-ups. And I didn't tell on nobody. But I was respectful. I didn't have to tell on nobody because I didn't treat you guys like shit. It wasn't in my best interest, was it?
Well, I think, as I said, I think that's what Russ is, the basic key here is that right now, in order to get the information out there, in order to hopefully stop, extreme measures that's being taken, let's say in Lansing and I think Washington's a whole nother different ballgame, to be honest with you. I don't think Washington was about a message. I think Washington was more about power and control. And Greg, I think that's the difference here. I mean, you have an attempt at making a message, and then the other attempt is more about power and control. How do you know the difference between two? Like, how do you know that this is about a message to get across and the other is about power and control?
I don't think you know that until you're in it, but I think one of the key components here is that they did let all the staff go. They got them out of there. Now we don't know, and we won't know for a few weeks. I'm trying to get some inside information, a little inside baseball, as to did the offenders tell the staff ahead of time? Because the last riot that I was at a facility in Kansas, I actually got told, hey, things are about to get ugly in here. You might want to get your people out. And sure enough, we got we backed out because we saw it happening, but it's the only way we could do it. They let us know, because at any time, there's to Chris's point, there are 150 inmates in there, and there's maybe 3 officers if we're lucky. So we know they got us by numbers on a mass scale. So we let them blow off that steam, let them go through that process, and then try and resolve those issues.
Bro, burn a mattress. Who gives a fuck? Burn that shit. It's yourself. Burn it. I gave you that mattress. What do I care? You're the one smelling that shit, not me.
Well, yeah,
Is that not the theory you take when somebody smears shit on their wall? You smell it, not me, man. I'm not wrong though, right? I'm not. I lived it, so I know I'm right, man. I lived it.
Hey, Dr. Z
truth, but we both know that's the way it is.
Dr. Z from Australia thinks you're a decent bloke. He's from Australia.
I never bloke nobody in my life to get where I'm at.
I
know, man. I know.
All right. All right. Hey guys, before we come to a close, I want to answer one more question from Trevor. I saw it up here before, and also Dana mentioned a good point too. If we can get a hold of the proper stats and really start showing the stats that show the success as opposed to just the failures, they'll see that the success is obviously a lot greater than the failures. But Trevor Pierce asked a question. I just want to make sure I get to it. Hold on. Where is it? Oh, okay. So he asked, is there a way to educate these inmates to help with fear? And I thought we discussed that, right? We talked about, making sure the information gets out there, making sure it comes from people that with respect.
Tell the pod father. Tell the person in charge. Tell the person in charge of the pod. He's going to listen, I make them child molesters clean the fucking stuff out of them showers 4 times a day. You know why? Because they fuck kids and I don't. Bottom of the barrel. That's it. Hey, that's how it works in there. And you know it as well as I do. And they're going to kill them motherfuckers on the way out. But that's
all right, guys.
Thing.
So
they did their time. They do their crime. They do their time. That ain't my thing. I'm not there no more.
All right. So on and by the way, interesting. It was great to get your perspective, Chris, because I think honestly, we've had a few gentlemen who's spent time on the other side of the wall, and they were able to provide a very balanced perspective. And the messages that you came across, the fact that you said you were respectful to both sides, is what made me want to bring you on. And I think you give us a perspective that
but I still have my loyalty, and that will never change.
Well, it doesn't change on this end either, but it doesn't mean we can't respect each other. And also
that's it.
I respect the fact that you're changing your life around, from what you said in the message, that you're trying to go out there and do the right thing. So eventually, when you're where you need to be, you can share your story and people can relate to you and want to do good because you'll be the example of that. So
you guys know who runs the pod. You just got to get them to understand and believe you and trust you, and they'll make everybody else fall in line, man.
Well, I think that's why people like us, myself, I think Russ, Greg, I think that's why we survived our career, because we're able to manage the balance. Even when you get on the administrative level, you have to manage the balance between the population and custody, and I've never promoted an us versus them mentality, because in the end, I don't want people to think that it's us versus them, but I do think, and I'm not going to go back on this, is that the level of control, the position of authority has to come from that officer.
Absolutely, but you got to understand, them guys have your lives in their hands at the end of the day. They didn't want to hurt them men, so they didn't hurt them. When things get to the bottom, eventually it's going to come to that if we don't get them to understand, and that's what we got to do.
And that's what, that's actually a great closing thought that we could feed off of. I'll go with you first, Chris, because I want you to finish up on that thought you just said. So basically, what you're saying basically is right now is if we don't manage to get the right information out there, if we don't manage to show the inmates that we have a level of control over this, what do you think the outcome's going to be?
Anarchy. Communication's always key. Always. When has it never been key?
Hey, Russ, what's your thoughts on that? I do agree with him. I agree with Chris on that. I think that's my greatest concern right now, especially after seeing that video from Lansing, but also the concern in Washington.
I want all of my correctional brothers and sisters to have to put in as little effort as possible to get through this. And if we're having to go in and take back units and take back yards and take back day rooms and pods or whatever, you know, we're going to get hurt. The inmates are going to get hurt. We're going to see more of this, of these bad riots and things like that. Let's not do that. Let's stay on the front end of this. Let's make the smart moves. Let's play the smart cards.
Absolutely. You got to now it's pertinent. You got to. You have to. There's no ifs, ands, or buts. You have to show these men respect. And just like you, they have their captains, they have their sergeants, they have their corporals, all the way down to the bottom of the barrel. And it ain't the big muscle guy that's running the show, man. I never ran the show in there. I'm 6'4", 280 pounds. And I'll knock any motherfucker out who come up against me, but I did not run the show. It's the dude with the money that runs the show, man, just like every place.
Well, what's your closing thoughts on that, Greg? What's your thoughts on what Chris had to say about the final result if we don't kind of balance that education or the what the inmates feel are the needs that need to be met?
Well, Chris is got a very unique perspective, and you know, it's very comforting to hear him talk, because I am used to listening to hundreds and hundreds of different offenders on my caseload and in my experience, speaking the same way, talking the same language, making the same points. It's a very basic set of principles that we need to adhere to. And if we can get the information to them, it will take away a little bit of that fear. It's not going to take away the basic us against them mentality across the board, but we need to get the information to them. So we need to get back to good old fashioned shift briefings, making sure our staff know what's going on, and then find a way to get the information to the offenders, whether that be the warden putting out videos every day and putting it on the inmate channel, whether it be putting up memos, some way to get everybody on board, because Russ hit it on the head. We don't want the officers to have to do more work because they're already overworked. We don't want to scare the offenders any more than we have to, because they're already nervous. They don't have any control. So if you're out of control, the only thing you do is attack what you can control. So it's going to take a team effort. We're already working really hard, and we're behind the curve. We've waited too long to make this happen. So the steps need to happen immediately, and they need to happen consistently, because that's the only way we're all going to get out of this safe. But I do also want to point out, it's nice to know that since this is your show, you're running the show, Anthony, so you must have the money. Because Chris said the guy who runs the show is the guy with the money. So it's got to be you.
I don't know what money that is. Well, first off, let me thank you guys for coming on, including Chris. It was kind of last minute for him to come on, so I appreciate you taking your time coming on the show. I'm sure we'll have you on again.
One thought.
Yeah, go ahead.
The inmate advocates, the lawyer guys that get them out of the write-ups, have them tell them about it. Them guys are the smart motherfuckers, right?
Well, I'll be honest with you. You made a good point. It would be good for us to, sometimes when we have to make these universal precautions, it would be good for the lawyers to go back and explain to their clients why these universal precautions are taking place, instead of being quick to jump on the lawsuit.
I couldn't even get a phone call from my lawyer in there, bro. And I paid him cash.
Yeah. Well, hey guys, just in closing, guys, you know, the reason why we wanted to have this dialogue is the video that was sent to us earlier was a bit disturbing to us professionals, but I think the key was us understanding, you know, the difference between what could be potentially a message or something that could be power and control, but either way, both pose an extreme risk to staff who have to maintain that level of control. And I like what Chris mentioned also with Russ and Greg here, is that there's going to have to be that communication between the population and staff. And I was even echoed on the comments here where communication is extremely important, especially by staff that the inmates can respect. And this was a concern. The concern is right now is that there's a fear of the unknown. And basically, you know, when you have the fear of the unknown, these are the actions that could happen. And these are the risks now that our staff on the front line is potentially facing every day. And then you also have those from the outside that may not realize that they're motivating this type of negative behavior. And they have to be wary of that, because, you know, stuff like this, the biggest threat to custody is inmate unity. And what they don't realize is pressure from the outside could cause the inmates to unite.
Unity, man. Unity, not inmate unity. Unity.
I'll take it. Unity,
Unity, bro.
which
You're
winds
in
up being the
same
biggest
battle
threat.
I'm in. We just on different sides of the fence.
There it is. And guys, if you haven't, the show Tier Talks for you, brave men and women that work in corrections. So please subscribe, interact, engage, comment, hit that bell. That bell is going to notify you every time I post up a video. Stay safe.
You too. God bless.
All right, guys. So hold on, guys. I just got to stop it. Just bear with me for a second. I forget.